Welcome to the National Organization of Nurse Practitioner Faculty's podcast.
Welcome to the second series of the NONPF podcast, created by the Simulation Committee of NONPF. This year, our podcast series, titled In the Trenches, Confessions and Pearls of NP Simulationists, will center around the 2023 fall release of the NONPF Guide to Nurse Practitioner Simulations, a step-by-step approach. This guide, an e-learning book, was created by the NONPF Simulation Committee. The ebook is formatted to help NP faculty design effective, measurable simulations that address learner programmatic and national level competencies. Led by members of the current Simulation Committee, podcast moderators invite authors of the ebook to share pearls of approaching simulation from the perspective of the nurse practitioner.
Hi, everyone, and welcome to the NONPF Simulation Podcast. My name is Jeannie Rodriguez, and I'm an associate professor at Emory University and also a member of the Simulation Committee. Jenny, do you want to introduce yourself?
Yeah, thanks. I'm Jeannie O'Rourke. I'm an associate faculty at Loyola University in Chicago, also a proud member of the NONPF Simulation Committee. And we are super excited to welcome three guests today who are authors on one of the ebook chapters and it's the evaluation chapter. So I'm going to turn it over to Karen to get us started with our guest introductions.
Hello, I'm Karen Lassiter. I am a clinical professor at the University of Tennessee, and I am also a proud member of the NONPF Simulation Committee. Dr. Nye?
Hi, I'm Carla Nye. I'm a faculty member, clinical professor at Virginia Commonwealth University, and also a very proud member of the NONPF Simulation Committee. And Angela?
I'm Angela Powell. I'm an assistant professor at the University of Colorado Anschutz Medical Campus, and I as well am a proud member of the NONPF Simulation Committee.
That's great. Thank you all for joining us today. We're really excited to talk about the evaluation chapter from the ebook and just get some good information from you about evaluation with regards to simulation. So let's get started. So one of the goals of the evaluation chapter is to identify methods of simulation evaluation that are appropriate and aligned with the goals and objectives of the simulation experience. So without giving everything away from the chapter, could you define for us what you mean by summative and formative assessments and maybe give some examples for each of those?
Sure, I can do that.
Great.
A formative assessment is an assessment in a learning environment. It's a safe way to see how students are doing. They can practice skills. They get feedback instantly from their professors, also including standardized patients and their feedback. The more summative assessment would be where there's a graded assessment. Examples of ways you can use an OSCE is one way you can do that, and that's where you observe a student in a simulated experience and they get a grade for that. Rubrics can be used, checklists can be used, several different types of methods for both formative and summative assessments.
That's great. Thanks.
Great. Thanks, Karen. I'll pitch the next question. What are some examples, more common examples, of how to evaluate simulation experiences?
Well, I'll take that one. There's a lot of ways or a lot of things you might consider evaluating with simulation. Most of us think about the learner because we really want to evaluate the learner's skills, attitude, their knowledge. But there's other factors we can evaluate with simulation. So we may want not only the simulation participant, but the simulation scenario. We want to make sure that it's the appropriate scenario for the appropriate learner and the level of clinical learning they're at. We also want to evaluate the simulation environment. We want to make sure our simulation space is a safe learning environment for the student and it promotes a positive and safe learning. And then we also, when we have our debriefing sessions, we like to evaluate our debriefing to make sure that faculty, again, is also ensuring this safe learning environment. And I want to add something to Karen's. With formative evaluation, the debriefing is a great opportunity to provide formative evaluation or formative feedback And so it's a learning environment and it's safe learning. And so the students can practice, receive feedback, and then maybe go practice again if the time allows.
That's
Great. Thanks. So let's talk a little bit about validity and reliability of simulation tools, because there's lots and lots of simulation tools out there and lots of ways to evaluate the learner, the program, things like that. So can you talk a little bit, and this is in the chapter and it's really well defined, talk a little bit about how to choose a tool considering the reliability and validity of that.
Well, and I will take that one. One of the issues we have in nurse practitioner education is the lack of valid and reliable tool. A valid and reliable tool is one that's been tested on a specific number of students for the number of questions that are on the tool. There is data to say that it's measuring what it's supposed to measure, and that it is that when faculty members use it, that they're giving consistent reports. A big major change when we moved into the world of the new essentials and we're moving towards competency-based assessments, we as a profession need to be able to assess our students using valid and reliable tools. So since the new competencies came out, there's been a lot of work being done on developing tools. And I'm going to make a short plug for a tool that NONPF is working on. Just conflict of interest? No, it's not, because this is not that we're doing this for. But there are, because what you want, well, let me go back again. What you want to look at on your tools, you want to be able to measure the student performance. Are they meeting competency? So you want to actually be able to take a look, and there's a nice part of the chapter that looks at that competency, the specific competencies, particularly in domain 2, that are much more easy to put into a simulation. And then you need to have measures, questions that get to those specific competencies, but also that reflect what a student does in a nurse practitioner simulation, which is different from what they do in an undergraduate simulation. Undergraduates have the Crichton tool, and we didn't have anything like that. So, and the Lassiter tool, and there's others as well. So several groups have been working on tools. And again, I'm just going to talk about the one that we're working on here at NONPF, which is a based on a clinical reasoning tool. But we have done some of the initial work, and we've got some really good validity and reliability data that's come through. We want to do more because we really want to make sure this tool measures what we want it to measure. Because when we're looking forward into the future, we're looking at trying to address the time period that is right before students go to clinical, that comes out of the NTF guidelines, and then times 2, which is are they competent to practice, which comes out of the essentials. And so we're hoping that our tool is going to be able to look at that entire time period using just one tool. And again, hopefully the tool will be able to work in psych, in peds, in acute, in family practice, and et cetera. I forgot somebody. So, and NPs, and other professions.
And all of this.
But that work is being done. There are some other groups, and I shouldn't say, leave them out. There are some other groups that are also working on these tools. Sure. So hopefully, I'm going to say it this way, within the next year or two, I think that there's going to be a selection of tools that schools can choose from. And highly recommend using those, both for the formative, to be able to provide detailed feedback to the students, but also summative so that you can get a grade from it. So it should be able to be used for both.
I'd like to.
I just wanted to add one more thing with the reliability. I think it's really important for NP educators. A lot of times we have multiple faculty evaluating students. And I think the other concept that's really important that Carla mentioned with reliability is inter-rater reliability, and making sure that all faculty are, using the same tool and making the same ratings for the school, for the student, for the learners. I wanted to ask Carla, are we at that point with this tool? Are we doing the inter-rater reliability for this?
We are, and we have in our schools that we used for our first study. We had 4 schools across the country that we used for our study. And yes, we had really good inter-rater reliability, but just for fun and giggles, and actually for the psychometrics of the tool, we had to compare it against another tool. So each faculty member rated a student using the NP-SCA tool, and then also a homegrown tool, which, believe me, are pretty similar among all of our programs because we've all made them ourselves. And interestingly enough, the inter-rater reliability on the tools was good, but there was not good validity and reliability data on the homegrown tool. It just did not capture. And our new tool is going to be able to do that. So for all of us who are using our tools, we use the tool for my school for the study, and it does not have strong psychometric support.
Well, I think that's so important because, like you mentioned, we have a lot of homegrown tools. We have rubrics, and we don't have this consistency in NP education across the country or the world. And I think having these tools are so important, as well as tools that can evaluate students throughout the program for consistency. But I also wanted to make remark that this tool that NONPF is working on, it sounds like it would really be great for that NTF criteria that really wants to make sure our learners are ready and safe to go in the clinical environment, that they're ready to go as new providers, that they're transitioning to that role. And so this sounds like an amazing tool, and I am super excited for this to come out and use.
I am too. And it is supposed to go across the whole program. And as we get more numbers of data points, students, and ratings from their faculty, we want to be able to have that criteria that will tell you that, yes, the student is ready to go to clinical, and yes, the student is ready to graduate.
Yeah, I'm ready for you guys to try it out in acute care, adult care, acute care. We got to see if it works there.
That'll be next. Yeah.
That'll be great. I'm so glad you're working on that. That's really exciting to hear about. Well, since we're getting ready to close up, I'm wondering if we can go around and have each of you kind of share a pearl with us around evaluation and simulation, something that you think would be really valuable for listeners of this podcast. Why don't we start with Karen?
I think that when I am helping new faculty learn to do simulation, I always make sure that they provide the students with a copy of the rubric or whatever evaluation tool that they're going to be using, so the student will know what their goal is and what to work towards. And so that's one of the things that I always like to have new faculty do.
That's great. I think that's really valuable. Carla, how about you?
For me, it's really all about the setup for the simulation for the students, because we have all seen students that is particularly going into summative simulations who are losing their minds out of anxiety and stress, and which does not in any way assist them in performing to their best abilities in simulation. So having that real communication in the formative about the purpose of the formative, why we're doing it, what's going to happen to decrease that anxiety, and really spend a lot of time talking about muscle memory. You know, by practicing this here, you're getting this into your muscle memory, so you don't have to think about some of these pieces, and they become a natural part of your flow of your day. So I'm a big prep person when it comes to simulation, because I want them to come into their summative simulations and not be blown away by their high levels of anxiety.
Yeah, absolutely. Very important. Very important. Angela, how about you?
Mine is really very similar to Carla and Karen's both. I think the earlier you can let students or learners know about the evaluation process, the better. And so I like to use it in the pre-brief document that I give them at the beginning of the semester. And it has a part about evaluation so that they have every expectation. One, they're going to be evaluated formatively, like Carla said. And then two, that we also use another survey or evaluation tool, the DASH tool, to evaluate the debriefing session. And so that is ahead of time. They know what those are about, and they're able to have those in their mind when they're going through the experience to make sure that they can fully complete that to the best of their ability. The other thing I think is really important with evaluation is ensuring the consistency. Like I said earlier, I think it's so important that faculty are very consistent because the clinical setting is subjective when we have our preceptors, and that's one way of evaluating our students. But this way is a little bit better, I think, in one sense that you have the same faculty evaluating them over time, hopefully same faculty. And it's really important to have that consistency in evaluation methods. And so that's why I think I'm really excited about the tools coming out, because that's really going to make a big impact on evaluation of NP education.
Absolutely. Oh, Carla?
And if there's one more moment that you might not be able to kick us off here. What Angela was just saying about the clinical setting and all the differences, the other dream with the tool is to be able to use it in the clinical setting so that the preceptors and the faculty are talking the exact same language. We're measuring the students on the same piece, and it all needs to come with, and Angela said this earlier, I mean, really looking at how do we train people to use the tools to make sure we get good inter-rater reliability. I'm done.
And that's a hard task, Carla. I'm glad you brought that up. That's so difficult because that means we have to obtain inter-rater reliability on preceptors and with the tool. So it is such a daunting task. It's much different than the undergraduate world.
Right. We won't do that year one. We'll, bring it in slowly but surely.
That's the 5-year plan, probably, right?
Yes. That's great. Well, thank you, all three of you, for joining us today. And thanks, Jenny, for helping me moderate this session. Really appreciate your enthusiasm around evaluation and for your time here today. Thank you so much.
Thank you.
Thank you for joining us today to hear from our NONPF simulation experts. This podcast has been written, directed, and produced by David House, Jeannie O'Rourke, Elaine Kauschinger, Tedra Smith, Jeannie Rodriguez, Leanne Barfield, and Queen Henry-Okafor. Special thanks to NONPF CEO Mary Beth Bigley. The digital ebook is available for purchase on the NONPF website to both members and non-members. The opinions expressed in this podcast series or any product mentioned are not specifically endorsed by NONPF.